Hello, and welcome back to another recorded session for the American Board of Nursing Specialties Spring Conference 2021. My name is Janie Shoemaker, and I'm currently serving as your ABNS president. And we have a really great session right now that I'm very pleased to introduce the speakers for. It is Progressing Towards Specialty Certification as the National Standard for Nursing. And who doesn't want that? That's what we're all about. So I'm very pleased. I'm going to introduce our speakers today. I'm very excited to have them here with us. I think you're really going to love this session. I know I'm looking forward to it. So first we have Lieutenant Commander Joshua Weimer, and he is the Chief Nursing Informatics Officer and Vice Chair of the Informatics Steering Committee at Naval Medical Center, San Diego. He has been active duty U.S. Navy for 18 years and is a fellow with the American College of Healthcare Executives. He holds additional credentials in perioperative nursing, the CNOR, Certified Surgical Services Manager, the CSSM, Healthcare Information and Management Systems, Nursing Informatics, and as a nurse executive. He completed his Master of Science in Nursing Healthcare Informatics at the University of San Diego and his undergraduate studies at Seattle University. His other degrees include a Master of Science in Project Management and a Master of Arts with an emphasis on Enterprise Strategic Planning. Lieutenant Commander Weimer deployed as a staff and emergency trauma nurse with Expeditionary Medical Facility, Kuwait in 2009, a perioperative nurse with Expeditionary Resuscitative Surgical Systems Team 9 in 2012, and as an operating room department head with the NATO Role 3 Multinational Medical Unit in Kandahar, Afghanistan in 2015. He is active across the perioperative and informatics communities and currently serves as Secretary-Treasurer, Board of Directors, Competency and at the Competency and Credentialing Institute, Denver, Colorado. His best practice interests include patient safety, change management, crisis leadership, user experience, and informatics. So welcome, Lieutenant Commander. Thank you for your service. Our next presenter is Lieutenant Colonel Christopher Stuckey. He is a career Army officer and an expert in his field with 28 years of clinical operating room experience and board certifications as a certified nurse operating room, certified surgical services manager, nurse executive advanced, and in nursing informatics as a nurse scientist at the Center for Nursing Science and Clinical Inquiry. He provides expert analytical support and conducts high priority research. He desires to serve at the strategic level to engage in policy development and decision-making across the enterprise. His long-term goal is to develop a comprehensive research program to identify perioperative weaknesses with the aim of increasing healthcare quality and safety. His interests concern network analysis, informatics, systems, science, communication, and team performance. Welcome to you, Lieutenant Commander. Thank you for your service. As you can see, we have a couple of really high-performing folks here to talk to us today. We're so excited. Thank you for all you've accomplished and all you're doing for the nursing world. And without further ado, I'll turn it over to you.
Well, thank you, Ms. Shoemaker. It's absolutely a privilege to be here with you and your ABNS colleagues today. We'll start out with our disclosures. So conflict of interest, we have none. And then for disclaimers, we just want to really emphasize that the views that you will hear from us today are solely our own, and they do not reflect the official policy or position of the U.S. Army, the Navy, the Department of Defense, or the U.S. government. Next slide. So we're very excited about the topic of specialty certification and incredibly privileged to be here in this forum. And our objectives today basically are to review our perspective on the current state of specialty nursing certification, describe how specialty certification supports nursing excellence and continued competency, and then dig into how specialty nursing certification can elevate and revolutionize nursing care in healthcare in 2021. Next slide. So when we think about where are we going, it's always good to look at the past. And the Future of Nursing: Leading Change, Advancing Health report, really emphasize that there is value here. The quote we pulled is, "Nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression." And seeing the topic we're discussing with you today as an integral part of that is why we're here. Next slide. So what does it mean to achieve specialty boards certification? It is obviously an objective measure of one's professional knowledge. It indicates continued professional development. It's a progressive career step that vouches for the individual certificant's experience, and it validates and establishes that standard of competence, whether it be for the professional level or for the subspecialty itself. It emphasizes that skill set and then that professionalism. And it's often that springboard, in my journey, in each of the certifications I've pursued, it's served as a springboard and motivated me towards mastery. Next slide. When we want to become something or pursue something, it's always good to see who's out there and who's succeeding and who's driving success, and who do we want to be like. That's how I've modeled my career. And when we think about nursing specialty or specialty nursing certifications, there is a role model for us, and it is our physicians. When we think of our own providers or those we may have gone to for care or those we've chosen to work with, it's very highly desired and often a prerequisite for those providers, the physician community, to be privileged and credentialed. And the board certification is an integral part of their culture. 85% of US physicians have attained board certification in their specialty, and 91% of patients consider board certification as a factor in choosing their doctor. And I personally can vouch for my own falling into that group of wanting to have not only a provider I feel like I have a good relationship and rapport with, but I do want to know where they're at as far as their status within their profession. And that board certification represents that to me. Next slide. So in contrast, we look at ourselves. We don't have those same forces, right? You could argue that specialty certification, board certification is the culture of medicine. When we look at nursing, it's often voluntary, and the reimbursement structures are extremely variable across the country. When it is achieved, we look at those factors that may drive certification. It's often a requirement for employment, whether it or that enhanced standing among peers. So it's where it is greater percentage of uptake. It's because of factors such as these. And when we look at our current state and the fact that we're well below 15% in the 10 to 13% range, depending on where you look, we're really looking at something that area for improvement is just a start for the task for us. So progressing towards specialty board certification as a standard ultimately would require that we adjust. It needs to be a cultural component, and we need to create an established community standard or expectation around that if we ever want to see significant gains and ultimately pursue a model where specialty certification is our culture. Next slide. So what does specialty certification offer? And I think that one of the most valuable elements of it is when you look at successful clinicians of any stripe, they are lifelong learners. And specialty certification represents one of those frameworks where we can introduce and or reinforce lifelong learning. There are also incredible benefits from specialty certification that we will review with you here today. And there are multiple avenues for that. And again, recognizing the diversity of our profession and the diversity of the members of ABNS and all of your constituents, it really, obviously we would want those benefits to represent that same diversity. And then it serves as a transformational component to our professional relationships. Speaking to everyone here today, even though you're listening to this as a recording, you are in the top tier. You are those engaged, you are those contributing professionals. And I think when I reflect on my career, each progressive certification that I've acquired in my career has allowed me or enabled me to develop those transformational professional relationships that not only benefit me personally, but benefited the teams that I've led and the areas I influence. Next slide. And with this slide, I'd like to introduce Colonel Dr. Christopher Stuckey, and he will take us from here.
Thanks, Josh. It is an honor to be here and discuss such an important topic. Okay, so specialty certification is integral to lifelong learning. The American Nurses Association Code of Ethics supports specialty certification as an important component for professional development and lifelong learning by stating professional growth requires lifelong learning. Such learning includes continuing education, networking with professional colleagues, self-study, professional reading, achieving specialty certification, and seeking advanced degrees. Thus, nurses have a professional and ethical obligation to maintain individual competence and sustain professional growth and development throughout their careers. Next slide, please. Okay, the knowledge acquired in nursing school is adequate for initial entry into healthcare, but is insufficient over time as healthcare changes and the nurse gains experience and skill. So given the growing technological, financial, and administrative demands of the modern healthcare system, nurses must continually seek opportunities to enhance and validate their knowledge. So continuing competency is vital to ensure that nurses possess contemporary knowledge, skills, and abilities appropriate for their specialty really throughout their careers. So specialty certification provides a balanced framework for nurses seeking lifelong learning experiences, education, and assessment of continuing competency. Through the certification and recertification process, credentialing agencies ensure that competence is a continued and documented validation of achievement, which enhances the professional growth of nurses. Okay, next slide there. Okay, through initial certification and the recertification process, the nurse engages in continual learning that increases the breadth and the depth of their specialty nursing knowledge. So some credentialing agencies, such as the Competency and Credentialing Institute, they've developed innovative recertification pathways that target knowledge deficits and require active participation by the candidate through individualized learning that closes any identified knowledge gaps. And that's what really Dr. Stubenski is talking about on this slide. As nurses gain experience and develop from novice to expert, their level of competence and the ability to assess that competence should become stronger and richer. By requiring active nurse participation in developing individualized learning, specialty certification becomes part of the competency journey. Next slide. Okay, specialty certification provides many benefits to nurses, including a sense of personal accomplishment, validation of knowledge, and recognition from peers and employers. Certified nurses highly report that specialty certification indicates professional credibility while enhancing empowerment. Specialty certification can provide a path for career progression, a potential for increased salary, and a competitive edge in the job market. So although compensation varies by hospital, certification allows some nurses to receive a pay increase as an hourly adjustment or an annual bonus. I know this isn't for everybody, but for certain people it is. For example, 44% of respondents to the Association of Perioperative Registered Nurses salary survey reported financial rewards for certification with CNOR certified nurses, typically earning $1,700 more annually than non-certified nurses. So certification also provides employment advantages, as 86% of nurse managers report they would hire a certified nurse over non-certified nurses because of their proven specialty knowledge base, their greater professional commitment to lifelong learning, and their ability to serve as role models and mentors for others. So interestingly, the primary factor motivating nurses to seek specialty certification is their personal commitment to the nursing profession. In short, nurses seeking certification are proud of their profession and are committed to enhancing their knowledge to provide the best care possible to their patient population. Nurses find the certification process of continual learning and validation incredibly fulfilling and rewarding. Next slide. Okay, certification not only provides intrinsic benefits to individual nurses, but it also provides multiple safety benefits to healthcare consumers. Certification provides an external benchmark of overall clinician competence and offers the healthcare consumer assurance that a nurse has attained further learning to provide high quality specialized nursing care. So although understudied, some research evidence supports the relationship between specialty nursing certification and patient outcomes, including lower rates of pressure injuries and selected hospital-acquired infections, rates of falls, failure to rescue, and mortality. Next slide. Nursing specialty certification has many benefits to employers. So the ABNS position statement on the value of specialty nursing certification states that employers should seek certified nurses for their workforce. Organizations highly regard nurses who seek opportunities to advance patient care and act as an enabling force for change, which is really our specialty nursing population. Specialty certification promotes nursing professionalism and demonstrates critical traits that organizations value in employees. This includes demonstrating personal responsibility and accountability in ensuring professional competency, and a dedication to best practices while attaining the highest levels of clinical knowledge. Since certification signifies a commitment to lifelong learning and clinical excellence, employers can use specialty certification to identify potential managers and leaders. Thus, nurses with specialty certification frequently fill management positions. Okay, next slide. One of the key messages from the IOM report Lieutenant Commander Weimer discussed on slide 6 concerned the necessity to transform nursing's professional relationships with other healthcare professions. So the IOM report stated, nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. Next slide. Unfortunately, nurses are frequently not full partners with physicians and are often plagued by issues associated with organizational hierarchy and authority gradients. Hierarchies and authority gradients are key contributors to medical errors, and they impede the flow and quality of collaboration between physicians and nurses. Hierarchy creates a power imbalance that impedes effective communication by preventing clinicians from reporting potential safety concerns. Antiquated scope of practice regulations have also kept nurses from working to the fullest extent of their education and training, which became publicly evident during the coronavirus pandemic. The COVID-19 pandemic exposed weaknesses in the US healthcare system, including how antiquated scope of practice regulations limited the ability of hospitals to quickly respond to an evolving pandemic. Some medical organizations have historically opposed full practice authority and resisted efforts to increase access to licensed APRNs under the false guise of patient preference and safety. So nurses spend more time with patients than any other healthcare profession and are uniquely qualified to make informed decisions that influence patient care. So given their high levels of education, their intimate care knowledges, nurses are ideally qualified to drive operational excellence, influence policy development, and formulate strategic decisions that influence patient care. In an era where the influence of nursing remains limited on governing boards and physicians occupy a majority of senior management leadership positions in healthcare organizations, really the promise of specialty certification would help develop and elevate nurses as highly qualified leaders. Nurses should not function ancillary to medicine, but in a collaborative way that leverages the unique training of each discipline to enhance the delivery of effective patient care. We firmly believe that increased nursing specialty certification rates will transform these multidisciplinary relationships and create fuller partnerships with physicians. Okay, next slide. Okay, I'm turning back over to Josh.
Thank you, sir. And all this is building to the premise and the conclusion of the article that is the basis for this presentation, that progressing towards specialty certification as the national standard for nursing would not only empower our profession, but it would better the safety, the quality of the care we deliver to our patients every day. So this is a quote from our article. Specialty certification is an objective measure which assures the public that nurses demonstrate the highest level of professional achievement in their field. Incremental changes that increase professionalism and promote optimal outcomes could ultimately influence substantial and lasting change in the U.S. healthcare system. Next slide. So ultimately, how do we make specialty certification our culture? We have to provide those support resources. Monetary incentives are anywhere you see uptake and elevated specialty certification percentages, monetary or reimbursement incentives tend to be integral to that area. Robust recognition. Also, this is another key factor. Recognition and appreciation, whether it be from the departmental or the facility or the system level, is absolutely essential in driving uptake of specialty certification. Obviously, making it an employment requirement is also a huge indicator that an employer takes this specialty certification to heart as to the value it adds for their patients and their consumer. And then promoting it as have it as a part of your promotion or your step or your tier requirements for nurses. Within the culture of the Navy and across the services, obtaining my CNOR was integral to proving that I was a competent and engaged and leading OR nurse. And if I hadn't pursued that, I know that my career would have encountered way more barriers at that point. And then other tangible benefits. There's so many ways to reward our employees, our fellow nurses. As we look at the diversity we mentioned earlier across those organizations represented by ABNS, what works one place will not necessarily work another. And so knowing your teams, know your nurses, and you will know how to drive and change this culture. And then collectively uniting around the fact that it does add value and it does help us as a profession to pursue higher and better outcomes for our patients, higher safety and better outcomes. And then ultimately educating the public. In general, the public is not as attuned to board certification, specialty certification of nurses as they are to their physicians. So an element of this would be, we need to be proud of our specialty certifications. We need to promote that we hold certain specialty certifications. And we also, as certifying organizations, need to continue the evolution of our certificate, the offerings we give to the public and to our present certificates to show that continued progression and that evolution. Where are those gaps and how can we fill them? Next slide. So again, I mentioned just in passing, but specialty certification in the U.S. military, there are reduced financial barriers. We have formal prep material and exam discounts that we can achieve. We are reimbursed for exam and registration fees. Professional development wise, it is a part of our integrated culture. It's a cooperative environment where we support and encourage our peers to achieve certification. We have leaders and peer role models who carry the certification, and the expectation is that we follow in their path. And it ultimately becomes a prerequisite for advancement. While it is only one component of that professional nurse and their background in the extremely competitive environment that is the U.S. military, certification ends up becoming a differentiator for promotion and advancement. And then ultimately industry engagement. And we can thank many of your organizations for that, for those military partnerships, whether or not it be the discounted prep materials or exam fees, or the fact that several organizations offer the complimentary prep courses to large concentrations of military nurses where they can find them and come to agreements to present, or where boards and volunteer groups from your organizations have encouraged active duty military to become involved and engage and have an appreciation for the ability of the military nurse to contribute to your organization's efforts. And next slide. So ultimately, we're very proud of our work with the article Progressing Towards Specialty Certification as a National Standard for Nursing. But we know that this is just a start and a continuation of the conversation. And again, we're supremely privileged to be here. Next slide. And if you didn't already note, both of us are OR nurses by trade, and that's the genesis of Colonel Stuckey and our relationship and our continued partnership. And so we've also recognized in our lives, our professional lives and our personal development, that our certifications have mattered to us. So we've also considered the specific certifications that we hold. So with that, we'll go to the next slide, and we would love to take some questions.
All right. Wow, that was really a wonderful presentation. Thank you. Very informative. I personally learned a lot and had many takeaways and things to think about. So the first of which is, I think your statistics said, was it 89% of physicians have their board certification, somewhere in the 80s, the high 80s, your statistic on your slide. And 91%, I think you said, of patients consider choosing a physician that has a board certification. I know anybody listening on this session surely would agree, like you don't want to go to a physician who's not board certified. And so therefore 91% of them are. And one of my favorite things to say is physicians are board certified, nurses ought to be as well. So the whole premise of your talk is like, you agree, and that would be an excellent way to shore up nursing. The hard part is, how do we get there? And you've outlined some thoughts and steps to that. I couldn't agree more that nurses should not be working ancillary, but collaboratively. Absolutely. I think we have some work to do in the nursing profession. Yes. You're certainly more squared away in the military in how you work collaboratively. We need to translate that to the civilian world. There's a lot more work to be done there. I loved the support resources that you identified. You identified some that were monetary, recognition, an employment requirement, and so on. And I find it interesting because having been in a lot of positions in the past where I facilitated our physician contracts, if you think about it, all of those things are in fact provided for the physician. The physician's board certification is going to be paid for by the hospital or the group that they work for. They do get monetary recognition and other forms of recognition for that. It is an employment requirement. So I think the big gaping question that I don't know that anyone today is fully prepared to answer is, how do we get the nursing profession caught up? Because there is a lot to learn from our physician colleagues, as you pointed out. So how do we get nursing there? And I certainly appreciate the work that you two are doing on this. And I would say to our listeners, if you haven't read the article, that you can find a couple of slides back. That is absolutely worth your read. So I don't know, I would just ask both of you if you want to elaborate a little bit more on, if you have more thoughts on how on earth do we get the nursing profession caught up? And obviously the other tough nut to crack is educating the public. And so I've asked you about 10 questions now in one. But I just would welcome some additional thoughts on that if you have any. It's not an easy answer. It certainly would have been accomplished by now.
I have a few thoughts. Do you want me to go ahead and take the lead on this, Josh?
Sure, please do. And I have follow-on thoughts myself.
So it needs to be a professional requirement for nurses to have to seek specialty certification. So as we discussed earlier in the military, it's expected of us. And because it's expected of us and it's tied into, let's say, bonuses and career progression, and it's expected, the majority of our nurses working in specialty nursing roles are board certified. So I think that really this needs to become an expectation in civilian nursing as well. If it's an expectation, nurses have always led in education, and they would gladly do it. It just needs to be an expectation. So some of the biggest ways that that can change really is that the public needs to be educated so that they demand it. Employers need to require it. And nurses really need to be educated as well to see the value in this. Some of the best ways that that we can increase nursing specialty certification rates is to decrease some of the barriers, and one of the largest is costs. Like you discussed earlier, that most physicians they have their board certification paid for. I think that that would go a long way in nursing, because that's one of the largest barriers, because it's expensive and people they do not want to pay for it, or and also time. Really, nurses should be given the space and time to do some of these professional obligations that we should have, and physicians sometimes are given the times to go to work on, going to conferences and working on professional development issues. But nurses have historically not been given the time to do that. So this is really going to require a cultural change that is going to take time. I would like to see really employers include this into really job expectations. Because I think if it's expected, I think that nurses will work towards it. And something that we talked about in this article and Josh highlighted, really, so if you think about this, if there is an association between improved healthcare quality and specialty nursing certification, if our rate really is only 10 to 13%, somewhere around in there, I'm sure it changes from time to time. Really, the promise of specialty nursing certification is really to think about what would happen if we vastly increase that, even if it was 50 to 60%. If there's already an association between improved healthcare quality in this and certification, just really think how that would revolutionize healthcare. It's really fascinating to think about. And that's one of the reasons why we wanted to write this article, because I feel like it's one of the largest things that, or one of the best things that nurses can do to revolutionize nursing, professionalize nursing even further, and healthcare. Josh, you want to take over?
Yeah, and I think first of all we need to look at ourselves. So within the criteria, do we have any what would be the limiting criteria across the organizations that comprise ABNS? Are there barriers to associate degree nurses to obtain certification? What are the alternative forms of certification that may exist for those that do have such barriers? How are we leveraging existing programs like Magnet which calculate nursing certification into the scores or the like. And then, as Chris so effectively highlighted, if we do know that this has an effect on the quality and the safety of patient care, where is this as far as our the whole pathway to excellence effort, and then just us owning this as a profession, not to repeat, but educating the public. So what are those, as organizations, going back to your boards or to your volunteers and your educators, what are within our sphere of influence? What are those areas that are critical patient safety events that have yet to be recognized, maybe through our certification programs, or to be emphasized to the public on why that nurse should be fully qualified as the physician with certification. And then the other, ultimately, I think Chris and I, this is why we settled on this as a topic, is and something we really want to dig into and write about, and I'm sure we will pursue further in the years to come, is the ownership of this as a profession. Do we want to own our profession? Do we want to role model the kind of leader that can equitably engage with any healthcare professional without deferring to we respect their knowledge, but we do not have to defer to them? How do we own that space, mark out that space, and be those proud, collaborative, engaged leaders that we know we already are? We see rock stars out there, nursing professional rock stars, doing this already, and they are most often multiple certified, engaged, driven professionals. And so modeling the behavior we want to see, and again, we know that this group is going to be aligned with our general aim, but ultimately, how do we align the public's perception of us as a profession to that same level? And ultimately, too, let's own this. We need to get back into the schools as professionals. Nursing school should not be a place that we use like a sieve to winnow out 20% of people just for fun. It should be a place where we go in and we actually reach into those schools. As we have students come to us, we engage with them, embrace them, grow them into nurses, and then who want to follow in our steps and who want to reach the next level, versus achieving some level of accomplishment and ultimately settling in for whatever the ride is. So just that continued ownership, engagement, and really deciding and dictating their journey towards impacting better quality and enhanced safety.
Yep. Excellent. All very good thoughts. I love your thought about getting into the nursing schools, and I think that's something that all of our members across ABNS have relationships, and I'm thinking about my own organization and certainly the opportunity to do more of that. But it needs to start early, and we hear a lot from our students that we interact with that it's really not specialty certifications really not discussed very much in nursing school, if at all. The focus is more on that, let's go back and get that DNP or that APRN, and those are great things to do too. But specialty certifications sort of being left on the side of the road without much or any discussion at all. So I think that's a low-hanging fruit place to really dig in there. So I would like to thank both of you for taking the time to give this wonderful presentation to us today. I think it's just amazing. I learned so much from it and have so much more food for thought. I've got to share this with everybody in my organization. I'm sure all of our ABNS members will feel the same way. I think if there's ever a chance to do some brainstorming with the ABNS membership, if that would ever be of benefit to you, we may certainly tap you on the shoulder for that. I think there's certainly a lot of probably 100% aligned values and thought processes going on here. So I'd like to thank you both for your time. You are very impressive gentlemen. Thank you so much for sharing. Let you go, but hope to be in touch more in the future from an ABNS. And are you open to people reaching out to you if they have, if they'd like to have a discussion or have some questions for you? I know your contact information is on one of your slides.
Yes, please reach out to both of us.
All
We
right.
invite the engagement.
We do too. We do as well. So if there's ever any opportunity you'd like to have a conversation with us, I know we welcome that on this side, and we'll do the same with you. And I appreciate once again your time and your service. Thank you both.
Yeah, thank you so much.
Okay.